Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, in this episode, Anae is joined by Megan Doyle from SAAPRA as they take a closer look at two important studies investigating prophylactic percutaneous laser disc ablation, also known as PLDA. Now, PLDA is often discussed as a preventative option for dogs at risk of future intervertebral disc disease. But what exactly is the procedure? When should it be considered? And what does the evidence actually tell us about its effectiveness? Together, they unpack the research, explain the technique in practical, easy-to-understand terms. And then Megan also discussed recurrence rates following PLDA, potential complications associated with the procedure, and how outcomes compare with both prophylactic fenestration and no preventative intervention at all. Most importantly, they explore what these findings mean for veterinary rehabilitation professionals working with dogs before and after spinal surgery. So if you've ever wondered whether PLDA lives up to the hype or how best to support patients who have undergone the procedure, this episode will help you better understand the evidence and apply it to your clinical decision-making and rehabilitation going forward. If you're not a member already, our amazing online community of vet rehabbers from all over the world gathers in our Facebook groups. So if you haven't joined yet, you can head over to Facebook and request to be a part of the action. Our groups include small animal vet rehabbers, equine vet rehabbers, hydro vet rehabbers, and our business vet rehabbers. Now, this is for those juggling patient care and running your own practices. Now, in these groups, we regularly share tips, advice, and host live sessions with experts to support you on your vet rehab journey. A quick word from our sponsors. Support, prevent, and rehabilitate. That's the Paw Prosper way. We've built a portfolio of industry-leading brands like Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, and Blue Nine to give your patients the gold standard in care. And we have some big news. Paw Prosper is officially the new home of the Canine Rehabilitation Institute and Onlinepethealth. We're bringing the best products and the best online education together under one roof to help you and your patients thrive. As a special hello to the Onlinepethealth community, we're offering a one-time gift with your next order when you sign up today. So head over to pawprosper.com/OPH and join the movement in pet rehabilitation. Right, over to Anae and Megan.
Hi guys and welcome. This month we are doing another journal club with SAAPRA. Megan, thank you so much for joining me.
Thank you for having me.
Awesome. So one of our members asked for this topic. Thank you very much. And I want to encourage any of our members, if there's a specific topic or question that you come across in clinical practice, please bring it to us and we'll try and cover it for you. So today we're looking at prophylactic percutaneous laser disc ablation. And I had never heard of that before, so this is very interesting. Laser disc ablation is a minimally invasive procedure used to help prevent future intervertebral disc herniation in dogs, especially high-risk breeds like Dachshunds. It does not fix a current disc extrusion. Instead, it reduces the chance of another disc extrusion in the future. So inside each intervertebral disc, we have the nucleus pulposus, and that is the part that will herniate. PLDA uses a tiny laser to heat and shrink that nucleus pulposus. By reducing its volume, there's less that can suddenly extrude at a later point. It's a non-invasive procedure, and essentially the dog will be put under general anesthesia and placed in lateral recumbency. They then use fluoroscopy, so live x-ray, to guide a thin spinal needle into several disc spaces, usually between 6 and 8 disc spaces from T10 through to L5 will be treated. They then take a very small laser fiber and they place that through the needle until it is within that nucleus pulposus. The laser is then activated for about 40 seconds per disc, and that heats the nucleus pulposus, which causes vaporization and shrinkage of the soft center. The goal is to reduce the disc pressure and then reduce the amount of material available to herniate, and the process is repeated at each disc level. The dog wakes up and usually goes home the next day. All right, so in the first paper, Megan will take us through the outcomes and complications, and in the second paper, we will look at recurrence rates. Over to you.
So the first study that we're going to look at here was completed in 2003. So it was both these studies are retrospective study designs. In this particular study, they looked at a total of 277 dogs. So the criteria for including the dog or the history of the procedure done on the dog was that they had to have documented history of thoracolumbar intervertebral disc disease, and that they had undergone prophylactic laser ablation following recovery from an episode of the disc disease. So the dogs that included, they had to have a history of the thoracolumbar disc herniation, but that they had fully recovered from following treatment, being it either medically treated or surgically treated. So they had to have no active dysfunction or neurological dysfunction. They had to have no NSAIDs that were used up to 2 weeks before the laser ablation procedure was done. And then contraindications is very small dogs because they can't accurately insert the needle and therefore the laser into the disc space. And they had to have no active neurological dysfunctional signs, and also any dogs that have infections are also contraindicated in this procedure. Right. So as I say here, that it was only done if it was performed at least 2 weeks after they stopped the anti-inflammatory treatment. And then a neurological exam was also performed on all the dogs immediately following the anesthetic recovery, and dogs were then observed in the hospital for a minimum of 24 hours after the surgery. And then after the dogs have been discharged, the owners were then instructed to restrict the dog's activity to leash exercises for 2 weeks, and then to gradually increase the level of activity over the next 4 weeks. Okay, so and then the majority of the patients or the dogs used were Dachshunds, and they mostly use it in your chondrostrophic breeds because obviously those are the breeds that are more predisposed to the disc herniation. Okay, so your perioperative complications is your complications that occurred during the procedure. So there were only 5 of the dogs, so 1.8% that had complications during the procedure. The one Dachshund had a pneumothorax, and another of the other dogs had an abscess at the insertion site of one of the needles, but they deduced this to be from a contamination that occurred during the procedure or during the setup of the procedure with the needle. Okay, so 3 of the dogs developed neurological abnormalities, including proprioceptive deficits, paresis or paralysis, after undergoing the laser ablation. One of these was a 4-year-old Yorkie, which was evaluated early during the study period, and they had a history of recurrent signs of lumbar pain and incoordination of the hind legs. So at the time of the laser ablation, the dog did not have any clinical abnormalities, or the clinical abnormalities had been absent for 7 days. So radiography revealed multiple calcified thoracolumbar discs with possible narrowing of the T12 to 13 disc. So after the laser ablation, so within 24 hours, the dog was then admitted into the hospital, and they had paresis of the back legs. So they were hospitalized for 5 days. And during this time, the condition did not worsen. So the dog was then discharged. But 1 week later, the dog was readmitted with a 6-hour history of acute paralysis of the hind legs. So a hemilaminectomy was then performed, and the dog recovered without any further complications. So 2 other dogs had proprioceptive deficits and paresis of the back legs immediately after undergoing the laser ablation. They were then ambulating normally within 7 days afterwards. Right, so the time period in which follow-up was done to determine if there are any long-term complications. So the time period was 1 to 85 months, and the owner surveys were done via telephone. So of the 262 respondents, 75.6% indicated that their dogs were improved immediately after undergoing the laser ablation, and 22% said that their dogs were the same. And then 6 of the owners said that their dogs were actually worse afterwards. Okay, and then with regards to pain, so 75.6% indicated that their dogs did not have any signs of pain. And then 5.7% said that it was the same, and 6% said that it was worse. So 81.3% of owners reported that their dogs had not had a reoccurrence of signs of thoracolumbar disc disease or evidence of pain since undergoing the laser ablation. Yeah, okay, so in the study, there was a reoccurrence rate of 3.4%. So 9 dogs had a reoccurrence, and this was in the time period of 3 to 52 months. So 9 of the dogs in which their owners reported that they still had signs of back pain when they were re-examined after the procedure. So the results of the neurological examination and appropriate tests, including the radiography, myelography, and in some cases the CT, this indicated that in all 9 of them, signs were as a result of cervical intervertebral disc disease. All right, in addition to this, 5 dogs were re-examined because of signs potentially consistent with recurrent lumbar pain. So the results of neurological and musculoskeletal exams were unremarkable, but radiographs of the thoracolumbar area were obtained, and myelography was performed to rule out compression of the spinal cord. In all 5 dogs, disc spaces that had undergone ablation appeared to be narrower than normal, which is to be expected, but there was no evidence of compression of the spinal cord. So these dogs were then medically treated, and this consisted of cage rest and anti-inflammatories for 7 to 14 days. And then one outlier was that 1 dog developed discospondylitis at 2 sites, quite a period after the laser ablation, but they also deduced that this could be due to a contamination of the surgical apparatus during the procedure. Then there is also another procedure that they compared this to, they also compare it to in the other study, and this is surgical fenestration. But they have found that, as with surgical fenestration, ablated disc spaces are narrower than a non-ablated disc space, which basically means that it is doing what this procedure is meant to be doing, which is decreasing the pressure of the disc. Okay, so the prevalence of disc herniation at these sites are also reported to be lower, and a surgical approach to these discs may cause post-operative complications as a result of trauma to closely related anatomical structures. So the laser ablation procedure offers more of an advantage over surgical removal or fenestration because it is a minimally invasive technique. So we are lowering the complication rate afterwards. Okay, so 64 of the 262 owners in the present study reported that their dogs had signs of lumbar pain or muscle spasms associated with needle insertion sites following the procedure, but this then resolved within 5 to 7 days. But that does make sense to have a little bit of reactivity in an area where they had to insert needles. And then 3 of the dogs in the present study had proprioceptive deficits after undergoing the laser ablation. So 2 of these dogs had not had any signs of thoracolumbar disc disease at least 1 month prior to the procedure and recovered within 1 week with medical treatment after they had undergone the procedure. And this also included cage rest in the hospital. And then the third dog, which was the Yorkie that I mentioned earlier, so that dog had to undergo a hemilaminectomy, and then they made a full recovery afterwards. All right. So in particular, dogs with paresis or signs of recurrent back pain were then required to be treated with cage rest and to have not received any anti-inflammatory drugs for a minimum of 2 to 4 weeks before undergoing the laser ablation to permit stabilization of the attendant inflammatory response and fibrosis of an unstable disc after acute herniation. So they're basically saying that after this, they basically added this policy in when they were going to do the laser ablation in the specific institution. So they added that dogs had to be cage rested and that they had not received any anti-inflammatory drugs 2 to 4 weeks before doing it. And they found that after following this procedure, coupled with the requirement that dogs be free from signs of pain and neurological abnormalities, or have stable neurological abnormalities for the same period, no other dogs have developed acute post-ablation neurological complications at this institution, which I think is really interesting. And then in all 8 dogs in which a reoccurrence of lumbosacral disc disease was confirmed, the involved disc appeared calcified on the radiographs obtained prior to the laser ablation. So further studies are then needed on potential variation in laser energy necessary for adequate ablation of degenerated discs, particularly your calcified discs. All right, so overall, there was actually a positive response to this procedure in that 75% of owners reported that their dogs had improved immediately after undergoing the laser ablation. So some owners also found that their dogs were more active or less apprehensive during exercise almost immediately after the procedure. So they do say not to rely on this statement too heavily, but that in human medicine, an immediate relief of lower back pain has been stated as a benefit of laser ablation, and it could be thought that the same would be happening in the dogs. All right, so just interestingly, a previous study stated that fenestration was unnecessary if appropriate decompressive surgery was performed, because extrusion of an adjacent disc following treatment of an extruded or protruded disc was rare. So therefore, the authors of the study then recommended laminectomy and the removal of a single offending disc rather than performing prophylactic fenestration on all the discs. So in the present study, 16 dogs that underwent the hemilaminectomy for decompression of an extruded or protruded disc subsequently underwent the laser ablation. And one of these animals required a second decompressive surgery at another disc site, even after the laser ablation, suggesting that in subdogs, multiple discs may involve in recurrent episodes of your thoracolumbar disc disease. It is a positive outlook when looking at this procedure because it may help to prevent disc protrusions or extrusions in the future. However, additional studies are needed to determine how frequently thoracolumbar disc herniation occurs at multiple sites, and also the reoccurrence rates of neurological signs following medical treatment and decompressive surgery without your prophylactic disc fenestration or ablation. So basically, if the dog has undergone medical or surgical treatment for a disc herniation, what is that reoccurrence rate going to be without doing any type of prophylactic procedure, just so that we also have a bit more of a control so that we can compare to what effect or to what degree does the laser ablation and the fenestration actually prevent disc herniations.
Okay, super. And that's what the second study is looking at, is the recurrence rates and starting to answer that question. So I think that's really good to follow with that.
All right, so the next study is looking at the reoccurrence of disc herniation following percutaneous laser disc ablation in dogs with a history, of thoracolumbar intervertebral disc herniation. So this study had 303 cases. Again, it's also a retrospective case or study design. And what's slightly different about this one is that in the first study that we looked at, the time period in which they did a follow-up was 1 to 85 months, where in this study there had to be a minimum of 3 years follow-up information available, or in the case in which a reoccurrence had occurred before that.
But these studies were done at the same institution, right? And during an overlapping time period. So they would have had similar or the same cases with a couple of extra and different ones added into the second study. So I think that's interesting. We're still looking at the same place, the same location, the same facility, and the same cases, just with a slightly different time frame and then a slightly different perspective. And we're answering a different question in this paper. So I think that's useful information as well. Yeah.
Okay, so the reoccurrence rates following treatment of dogs with intervertebral disc herniation have been reported to range from 2.6% to 41.7%. And then when looking at surgical fenestration, they found the reoccurrence rate to be 0 to 2.4%. However, 2 recent studies have looked at this again, and they found it to be 2.3% to 12.7% after fenestration. And then Brizan et al. So they found that the reoccurrence rate was 17.9% following a single site disc fenestration and 7.5% following a multiple site disc fenestration. And I think this ties into what they said in the previous study, where they said that reoccurrences could be occurring at more than one disc site. So if you're doing multiple site disc fenestrations, you're kind of helping with that instead of just doing one disc, where it could be occurring at more than one. The purpose of the study was to determine reoccurrence rate and factors associated with the reoccurrence in dogs that underwent the laser ablation because of a previous episode of suspected or confirmed thoracolumbar intervertebral disc herniation. And they had to have a follow-up for a minimum of 3 years. What's also important just to note about what they said here about suspected or confirmed thoracolumbar disc herniation. So in the study, they looked at confirmed. So this was golden standard confirmed, and that was confirmed with an MRI or a hemilaminectomy. And then suspected was your clinical presentation. So they included both of these in the study. So again, the selection criteria is that dogs were eligible for the study if the medical record was complete, follow-up information was available for a minimum of 3 years, or unless a reoccurrence of the disc herniation was documented prior to that time. And then again, they should not have any pain medication up to 2 weeks before the procedure was done. And they had to have a stable neurological presentation, or they had to be free of neurological dysfunction before the procedure for a period of time. Okay, and again, the owner questionnaire was done by telephone or email. Okay, so I just also highlighted here just to show that they actually did the laser ablation at multiple sites for all the dogs, and the number of sites ranged from 8 to 3 spaces that were ablated. So like every procedure, there are complications that can occur. So there are complications that can occur during the surgery. And then acute complications, they say here that's 7 days or less after the procedure. And they found that it was ataxia after the procedure that continued for up to 7 days, soreness along the back, mild ataxia immediately after the procedure that resolved within 24 hours, greater pain than expected, requiring administration of pain medication, and a reluctance to move for 8 days after the laser ablation. And you can also get paraparesis the morning after the surgery, which then resolved within 4 days. Paraparesis the morning after surgery that resolved in 3 days, and pain persisting for 5 days longer than is expected. And then your chronic complications, which is more than 7 days. So this they only found in 2 dogs. One of the dogs was pain on palpation of the spinal region that required treatment with an NSAID. And then the other dog was that they were licking or chewing the left back leg or left back paw 1 month after the procedure. Okay, so there was a percentage rate of 94.4%, in which owners indicated that their dog was the same following the procedure, and 56.3% said that the dog had improved after the procedure. 89.9% responded that they believed that their dog was not painful, and when the owners were asked to rank their overall satisfaction with the procedure, 83.2% gave it a 10. All right, so of the 303 dogs, 60 had a suspected or confirmed reoccurrence of the intervertebral disc herniation. All right, so 35 of the 185 dogs that had been treated medically for an episode of the disc herniation prior to undergoing the procedure had a reoccurrence of the intervertebral disc herniation following the procedure. And then 14 of those dogs had experienced multiple reoccurrent episodes prior to undergoing the procedure, with each episode being treated medically. And then 22% of dogs had undergone surgery for treatment of an episode of intervertebral disc herniation prior to undergoing the laser ablation, experienced a reoccurrence of disc herniation following the ablation. Okay, there's nothing there. Okay. So this procedure has historically been documented as a reoccurrence rate of 3.4%, which is what they said in the previous study, is what they found the reoccurrence rate to be. However, the mean follow-up time for those patients was 15 months, so a range of 1 to 85 months. So for the present study, they found the reoccurrence rate to be 19.8%. And then, as I mentioned, this included dogs that were suspected to have the reoccurrence rate, but which the disc herniation was not confirmed. And then,
it included those dogs with a grade 5 presentation, which is basically just back pain. So no neurological deficits, just back pain. And then when they took away those grade 5 cases or the back pain cases, then that came down to 3 or 4%, which is a really good recurrence rate, or a very low recurrence rate, which I think that's interesting. It's good.
Yeah, it is interesting. Yeah. And then they also said here, based on that, because a previous study, when they looked at it, they had not looked at pain, because they said that it could be that pain could be an indication of a completely different disease process. But they found that you can't really take away the pain, because in some dogs, pain is the only clinical sign you're going to find with the intervertebral disc herniation. Well, that's the first sign that you find with your patients. Okay, so based then on the findings of the study, they then rejected their hypothesis that the reoccurrence rate for dogs that underwent the procedure and for which long-term follow-up information was available would be similar to the 3.4% reported by Bartels et al. So although the rate of reoccurrence of confirmed intervertebral disc herniation in the present study was 3.6%, this included dogs with signs ranging from pain alone to non-ambulatory paraparesis. And in contrast, the 3.4% reported by Bartels et al. Included only those dogs that had non-ambulatory paresis or were worsening of their neurological signs. Okay, and then an additional benefit that they found was that a reduction in intradiscal pressure that resulted in persistent or repeated back pain. So it can also help to relieve back pain. So, for example, 56.3% of owners reported that their dogs had improved immediately after the procedure. Okay, so although these are also all subjective findings, because it's based on feedback from owners, these findings may suggest that dogs have subclinical back pain more often than what we thought, because as the previous study said, in humans, it has found to provide immediate relief of back pain. And now we're seeing owners that are saying that their dogs had immediately improved after the procedure, that it's kind of indicating it could be the same as in humans, where dogs have more subclinical back pain than what could be previously thought. So the reoccurrence rate in this study following the laser ablation was not significantly different between dogs that had been treated medically for previous episodes of herniation versus dogs that had been treated surgically. So this reoccurrence rate does not differ between whether a dog has been treated medically or whether they have undergone a surgery, which is actually, I think, quite a good thing, in that every dog will then have that chance, no matter if they did the surgery or it was conservatively treated. Yeah, so previous treatment does not play a role in the success of the laser ablation. And then, as they say here, although the effects of disc mineralization was not specifically evaluated in the study, it is possible that mineralization could have played a role in the reoccurrence of clinical signs after the laser ablation. So they need to look at the energy of the laser when it comes to a normal disc and a disc that has been calcified. Okay, so a particular concern with the laser ablation is the inability to insert the discs into some narrow or fibrotic disc spaces. So it gets a bit more challenging to insert the needle into a disc space that is quite narrow. And they state that a suspected reoccurrence could have occurred, or the reoccurrence of some of the dogs could have occurred from an inability to treat a specific intervertebral disc space at the surgery, which was then reported. So they were unable to then get the needle into that narrow disc space or into that fibrotic disc, and that could have been why there was then a reoccurrence of the disc herniation. Okay, so the reality that the laser ablation can result in postoperative pain or ataxia must be discussed with owners. So for this procedure, the complication rate is not 0, the success rate isn't 100%. So it's going to be like any other procedure where there can be complications associated with this, and we'll just have to obviously inform and discuss this with the owners. So currently, they only perform laser ablation on disc spaces from T10 to 12 through L4 to 5. To date, laser ablation of cervical disc spaces has not been attempted in a large number of patients, but they have done it in a few dogs, and they mostly do at C2 to 3 and C3 to 4. And 4 to 5 could be consistently ablated owing to the presence of the scapula, preventing the needle placement caudal to these sites. So most often, laser ablation is performed on dogs that had a previous episode of confirmed or suspected intervertebral disc herniation, and which have then completely recovered, as we've mentioned in the beginning of both of these studies. But there was one where they did do it on a dog. There we go. So they say to date, 5 dogs have undergone the laser ablation as a true prophylactic procedure at the request of the owner. So although the laser ablation does have risk of complications, the risks do appear to be low. And then they do list quite a few limitations. So it is a retrospective study, so interpreting the medical records can sometimes be difficult. And I think also with it being a retrospective study, there is a level or selection bias as well. So when they're selecting it, there could be a level of bias to it. And then also that there was no control group, so they weren't able to compare the reoccurrence rate or the risk factors to dogs that had undergone treatment of a history of disc herniation, but they hadn't undergone the prophylactic procedures. Okay, and then also additional limitations included the fact that multiple clinicians performed the procedure, and the study consisted of dogs treated over a long period of time, because they also stated in the study that the procedure, it's like any other procedure, and that it's also dependent on the skill and the experience of the surgeon performing the procedure, because they also mentioned about time, how one surgeon did it in about 20 minutes or 25 minutes compared to others who weren't as experienced in it, and they took a little bit longer. So it's also based on the experience of the clinician as well. Okay, so likewise, reoccurrence of disc herniation following the laser ablation was largely based on the owner assessment. So it could be possible that because it's coming from an owner, they can over or underestimate the reoccurrence. And then finally, the diagnosis of the intervertebral disc herniation was not definitive in many dogs either before or after the laser ablation, which may have led to inclusions of dogs without the disc herniation or to miscalculate the reoccurrence rate. Okay, so in conclusion, the results of the present study suggested that the laser ablation is relatively safe, a minimally invasive procedure that appears to decrease the rate of reoccurrence of disc herniation in dogs that underwent the procedure because of a previous episode of suspected or confirmed intervertebral disc herniation.
Amazing. Thank you, Megan. So what do you feel this means for us as rehab therapists? Is this something that we should be seeking out and recommending to our higher risk IVD patients? What do you think?
I think it has its place, but I also think it's because obviously we hadn't heard of it yet. So it's also a thing of it sounds like quite a highly advanced procedure. Like not every vet, not every surgeon is going to be trained to do it. So that means it's definitely going to be more rare. And also the question of, will owners be able to, afford to do it as an extra, especially because most of the dogs had to have no neurological signs that have worsened or been present for up to 1 month. So if I had to think about myself as an owner, I'd be just like, oh, well, they haven't really shown anything for a month. They're doing really well. Do I want them to undergo the procedure? Because obviously it's not a risk-free procedure. But I definitely think that it does have its place. And as we always say, prevention is better than cure. And if this is a way to prevent disc herniation, it's relatively safe. We're not going and, as it does with fenestration and with hemilaminectomies, where we're creating a surgical incision and we're, creating trauma essentially in that area. If this is a nice, minimally invasive procedure, I mean, the fastest time that there was 20 minutes, that's quite quick. So, yeah, I mean, the fact that it is basically minimally invasive, I think I'm a little bit more inclined to do it, because it's always, I mean, surgery.
Surgery is surgery still, yes.
Yeah.
But I can understand that, they've had 5 clients at least seek it out already, because if we're thinking of a lot of Dashi owners are thinking about IVD, and they're thinking about when their dog might, blow a disc. And so it's always something, not for everyone, but for sure I've come across owners who are thinking about and worrying about it. And so this could be a way to help them feel like they are doing everything that they can to prevent it from happening in the future. So I think it's positive. I like it. There are limitations, like you said, in terms of availability, because they'll need the specific laser and they need to use fluoroscopy to place the needles. So I think those are limitations in terms of equipment, and then of course the training on top of that. So yes, but I think positive. And if I think about what we're going to do with these patients, if they come into, like, if we get a referral, or if one of our clients have had this procedure done, how do we want to treat them? How do we want to work with them? Of course, we don't have any protocols or recommendations in place from a rehabilitation perspective. But what stood out for me in these studies is that many of the owners reported it was difficult to have that period of 2 weeks restricted activities, because the dogs felt so good. They just wanted to run and jump and play, which is fantastic. So how are we going to help protect those patients for a period of time post-surgery? I think we can play a role there, because we can help give them safe ways to let out their energy, or to start to express movement that is no longer painful, that potentially was painful before. So we can look at that. I think we need to remember that they're still, even with the procedure, they still have a risk of IVD recurrence. So we still need to treat them as at-risk patients. So we want to do all the things that we would normally do, like weight control, keeping them well conditioned and strong, and then avoiding high risk activities like jumping on and off of the couch, for example. So those are some of the things that come to mind if I think about how I would want to approach a case like this. I would also want to think about what the impact is of not having a full disc between the vertebra. What are the consequences going to be of that in the long term? If we are not dealing with an athlete, then potentially there should be no consequences. But I would love to know how these patients are, 10 years down the line. Have they developed anything like spondylosis or facet arthritis or any of those kinds of spinal conditions? Are they at risk of that? So I would love to know that kind of information in the long term. And I would have that in the back of my mind, that there is a change in the stability of the discs. And so how are we going to support that from a muscular and conditioning perspective? And those are kind of my thoughts.
Yeah, and also what you said about helping recovery afterwards, especially those dogs that had ataxia or paraparesis for about 7 days afterwards, just to help, help with proprioception. Maybe they recover faster, or because I mean, muscle atrophy also happens so quickly. So yes, it will be only theoretically for 7 days, but just to help with that preventing of muscle loss during that time period, especially when you do expect that to potentially happen after the procedure.
Amazing. Thank you so much, Megan. Guys, if you are listening or you have questions, please let us know. Thank you so much, Megan.
Thank you.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free. So go and check them out at pawprosper.com. And also don't forget to bookmark the next Vet Rehab Summit on Saturday, the 14th of November, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.